welcome to all of you who are here tonight. This is the third annual Adam Clar Neuro-Oncology Nursing Lecture. And we are really delighted to be back in person. This is a real treat. For those of you that don't know me, I'm Margaretta Page. I'm a longtime neuro-oncology nurse here, and I welcome you on behalf of the neuro-oncology service here at UCSF. I'd like to start just by telling you a little bit about Adam Clar. Without him, we wouldn't be here tonight. So in 2004, Adam was diagnosed with a brain tumor. He was 25 years old, and at that time, he decided to face this challenge. He stayed positive, he was energetic, and he really tried to live each day fully. And remarkably, he continued to grow and develop and set new goals for himself in spite of his diagnosis. And 10 years after his diagnosis, he made a career change and graduated from Samuel Merritt University with an RN degree. After he graduated, he was a school nurse and then moved down to Fresno, where he worked at Community Regional Medical Center as a cardiac nurse. And in 2018, he had just landed his dream job down in Santa Cruz and was about to move back here when he required some more surgery for his tumors. And sadly, about 6 months after that time, he passed away. In that time, he was able to recognize how important his nursing colleagues were in his work, and he wanted to give back to all of the professional caregivers that were his colleagues and who took care of him and his family. And so with Elizabeth, he set up the Adam Clar Neuro-Oncology Nursing Lecture, which is a fund that we have to offer an opportunity, an evening for nurses and allied health professionals to learn a little bit about neuro-oncology. And I think the other neat thing is it's an opportunity for us all to be together as we are tonight and celebrate what we do and each other. So I thank Adam for that. In addition to the lecture, the fund has allowed us to offer an award for an exemplary neuro-oncology nurse, and we'll be doing that tonight as well. I want to tell you a little bit about the award. For those of you that were here at the first lecture, we've actually only given it one time. Our first recipient was a nurse that some of you may remember, a woman by the name of Sharon Lamb. She has a long history of providing care and support to patients and families with brain tumors, and actually knew the Clars when Adam was a patient. So back in 1990, okay, some of you might have just been in preschool. Sharon was deep in her career as a neuroscience nurse, and for those of you that don't remember, the 90s were actually the decade of the brain. How many remember that? That was a big time where the government and all kinds of people were putting a lot of energy and focus on discoveries for neurology. And so in that year, some of the things that came to be, actually the biggest one I think that affected all of us in neuro-oncology was the development of the MRI. So it was when we started using the MRI, and so we had these beautiful new images of the brain. We could see things, and it really transformed neuro-oncology nursing. So, and neuro-oncology, the field, actually. So we had that. We had the development of computational neuroscience. We learned about neuroplasticity, and critical phases of neurodevelopment all happened in the 90s. Another thing that happened in the 90s was that Sharon was a nurse, and she was recognized as part of the celebration for the decade of the brain for her expertise, her care, and her compassion. She actually won this Bronze Ribbon Award that I have down here. It's by a famous sculptor by the name of Fritz Olsen. This year, Sharon, who couldn't be here with us tonight, asked that we pass this sculpture on to the next recipient of the Adam Clar Award, and we will pass it on from year to year. So it will serve just as a reminder of nursing and neuro-oncology expertise, and I think she hoped that it would also serve as a reminder of those expert nurses that have gone before us and those that will be coming ahead in the future. So there's our award, the bronze ribbon, okay? So our nominee tonight is a nurse who literally has spent her entire career here at UCSF in neuroscience nursing, and over the last more than 34 years in neuro-oncology. I am sure that she's the most senior staff in neuro-oncology nursing at UCSF. She actually started out as a student on the 8th floor over here at Moffitt Long, and where she stayed and rose to be a CN3, and then went on to be a neuro-oncology nurse. And the neuro-oncology clinic used to be right up there at the end of 8 Long. In that role, she did it all, from telephone triage, clinic nursing. She collected and entered treatment and symptoms data for clinical trials. She administered IV and oral chemotherapy to adults and children, as well as supported patients and families at the end of their lives. She is one of the first in the field of neuro-oncology nurses. As the years went by, the clinic grew, the research needs became more complex, and she welcomed and has mentored many neuro-oncology nurses since that time. She as an expert and has served as an educator to the university around neuro-oncology nursing and the community at large. She's an expert at managing clinical trials, and she works with our medical team to open and run trials safely. She now oversees more than 8 nurses, a research staff, and an administrative staff who support the neuro-oncology clinic. She was here almost every day during the pandemic, keeping the doors open and the patients and the staff safe and cared for. She is calm, warm, kind, funny, and generous to her patients, the families, and her fellow staff members. She is an example of what it means to be a leader, a team player, and an all-around amazing neuro-oncology nurse. This year's award goes to Jane Rabbit.
Okay, I feel really old the way she presented that story. When I started, Margareta was the first person that I hired as we started to expand our team. So we've been a team for a long, long time. Kind of like the Oscars, Margareta told me, you better be here tonight. So I had a little bit. So I just want to thank you all very much for this honor. I want to thank Elizabeth and Mark and Linda for creating and funding this amazing educational endowment that supports the continued education of nurses in the field of neuro-oncology. It is such a wonderful legacy to Adam. Nursing is a wonderful profession. I hope you all agree with me. Allowing for nurses to have so many fascinating and creative positions. When I started here in 1984, I didn't know where I was going. 8 Long offered me a job. I'm like, neurosurgery? I can do that. Okay. And then in 1988, Dr. Michael Prado said, do you want a job in neuro-oncology? I'm like, sure, I'll do it for a year. So, and then I've never left. We gave all sorts of chemotherapy. I hate to say this, but I used to pry my lines into the garbage can because there was no policy or procedure. Margaret and I had the wonderful and terrible task of taking care of pediatric patients. We knew wheels on the bus, backwards and forwards, trying to distract our little kids. But it just has given us so much opportunity. But I would say being able to take the journey with our patients in neuro-oncology is and always has been most rewarding, right? It's like we have friendships within our peers and our team and the hospital, but it's really the patients that warm your heart, make you realize you're doing something hopefully that's impactful. And I'm always amazed how they are involved in our lives. You know, when they come back and say, "How was your vacation?" And I'm like, "How do you remember that?" Right? Because, you know, we become a team in that journey. And I think that is the most wonderful part about this job. So thank you.